Hello friends, welcome to a new chapter today in ENT. In this chapter, let us now learn about the foreign bodies of nose. So whenever there is a foreign body in the nose, we will have to suspect it in children. Most commonly, if there is any child with unilateral foul smelling discharge in a child, then always suspect nasal foreign body, and then we should remove it under local anesthesia or general anesthesia. So in children we can use oral positive pressure technique can be used, which is called as parents kiss technique can also be used. Okay, but generally we are not using these techniques nowadays. Nowadays, with the help of the advent of endoscopy, we can easily remove the foreign body in the nose. Then if you see complications, whenever this foreign body has been neglected, then it leads to nasal infection or vestibulitis. It can form sinusitis or rhinolith formation can occur. It can also cause sometimes the child may inhale that foreign body into tracheobronchial tree. Okay, so this is about foreign body in nose. Then we have something called as rhinolith. What is rhinolith? Rhinolith is nothing but the stone formation in the nasal cavity is called as rhinolith. This stone formation is the stone is formed around some exogenous foreign body, and that is called as rhinolith. So here in rhinolith, calcium, magnesium, phosphate ions will deposit around the mainly calcium, magnesium and phosphate ions will deposit around the foreign body, thus leading to formation of rhinolith. This rhinolith is most common in adults, and it causes unilateral nasal obstruction. Initially it causes foul smelling discharge which will become blood stained later. Here the main treatment is you will have to remove it under general anesthesia. Some can be hard and irregular. In such cases you have to use lateral rhinotomy. So this is about rhinolith. Then after rhinolith we have something called as nasal myiasis or maggots. These nasal myiasis or maggots is presence of flies or ova or flies, presence of ova of flies, that is Cryosops species. Cryosomia species flies ova are laid in the nose, and this leads to the ulceration and destruction of the nasal structures. It can even cause atrophic rhinitis most commonly. So this is about nasal myiasis or maggots of nose. Then if you see next, these maggots of nose are seen almost 3 to 4 days. Within 3 to 4 days these maggots are produced, okay, and this will lead to intense lacrimation, itching, headache, sneezing and thin blood stained discharge. These will lead to increased itching, lacrimation, headache, sneezing and blood stained discharge. Okay, later the maggots crawl out of our nose, giving rise to foul smell. Okay, what are the complications? Complications are important. It can cause the destruction of nose, sinuses and soft tissues of face. It can also cause destruction of palate and eyeball. It can cause fistula in nose and palate. It can also lead to death due to the meningitis. It can go to the brain, complicating the meninges and infecting meninges, leading to death. So how are you going to treat it? Treatment is very simple. You should instill the chloroform water and oil in the nose, and you will have to, after instilling chloroform oil and water, you will have to plug the nose so that these maggots will not crawl out. So this is about the maggots. Then what is important next is one of the important differential diagnosis. What are the causes of unilateral blood staining in or nasal discharge in a child? In a child, the cause of unilateral blood stained nasal discharge is, it can be foreign body of nose, rhinolith, nasal diphtheria, nasal myiasis and acute or chronic unilateral sinusitis. Okay, so this is about the unilateral nasal discharge. So thank you guys for watching my lecture. In the next class we will learn about rhinitis. Thank you.